Welcome to Genius Healthcare Solution, and today we will discuss modifiers. So modifiers is very important, and if person have a good modifier knowledge, he can do very well in medical coding industry. So as modifiers are two digits numbers. Okay, so modifiers are two-digit number. It can be alphanumeric, it can be numeric, or it can be alphanumeric. So, but it remain only two digits number. As we already learned that about the ICD, so ICD are 3 to 7 digits and CPT are 5 digits. HCPCS is also 5 digits, but modifiers are alpha, numeric, or alphabetic, but only two digits. So we can use modifiers with CPT codes or sometime HCPCS code, but we never use modifier with the ICD code. So our first modifier is 22, modifier 22. So modifier 22 is increased procedural service. So when we need to use modifier 22? So we need to use modifier 22 if physician performing any procedure and there is a difficulty factor he found and it increase the procedural time. So in that case, what we need to do as a medical coder, we need to provide 22 modifier. So whenever you use 22 modifier, most of the time insurance company put the claim on hold. So how they will release the payment? They will only release the payment once you send them the medical record. So it's always advisable, whenever you put modifier 22, you always need to send medical record of the patient. So there are some circumstances where 22 modifier need to use, as I already told you that it increase the procedural time. So it can be unusual complication. Excessive bleeding require additional work. In that scenario, you can put the 22 modifier. Severe adhesions or anatomical variation. If there are adhesions from the previous surgeries, then you can use 22 modifier. Longer operative time due to complexity, then you can use 22 modifier. So 22 modifier, as we already say that it should be increase the procedural time, so it can only use with the surgical procedures. It cannot be used with the evaluation and management service. So now if we check the example. So if physician perform the colonoscopy and there is a excessive bleeding for that. So colonoscopy with polyp removal is the procedure and there is a excessive bleeding which physician require additional 25 minutes to control that. So what we need to do? We need to provide 45385. This code represent colonoscopy with polypectomy via smear technique. And because physician spend additional 25 minutes to control the bleeding, so we need to provide 22 modifier in this particular scenario. So this kind of scenario we need to put the 22 modifier. And another scenario we can discuss that patient have complicated total knee replacement and due to some bone deformity, physician put extra effort. So again, the CPT code for total knee replacement is 27447 and we need to provide 22 modifier for additional workup. The next modifier we have 25 modifier. So when to use 25 modifier? So there are three modifier, 25 modifier, 57 modifier and 24 modifier. So all these three modifier we need to use with E&M service only. So if physician performing evaluation and management service, then only we can use these modifier. And again you can say vice versa. With E&M service we can only use these three modifiers. So when we use 25 modifier, so before to understand the 25, 57 or 24 modifier, we need to understand the global period. So what is global period? So global period is a warranty period, kind of warranty. So if anything happen during the global period, physician need provide service, then either it's a bundle or we need to provide the modifiers. So global period can be either 0 days, 10 days or 90 days. 0 days and 10 days falls into the minor procedures. So if any CPT code which have 0 days global period or 10 days global period, it fall into the minor procedure. So how we will check the global period of any CPT? For that you need a software. Either you need Encoder Pro, you need Codify, or you need 3M or any other practice management software where information available for the global period. So you need to put the CPT code over there in the software. You need to click, and then when you check global period, you will find whether it's 10 days, 0 days or 90 days. Sometimes it will be XX, YY or ZZ or MM. So the global period cannot implement on these services. So there are three categories of global period: 0 days, 10 days and 90 days. 0 and 10 days are in the minor surgery and 90 days in the major surgery. Now we discuss Modifier 25. So if physician perform evolution and management service, and along with the evolution and management service, he also perform minor procedure. But that procedure should be for different reason. The reason for the visit is different and the procedure physician perform should be different. In that case, we can use 25 modifier with evolution and management service, because if we do not use 25 modifier with evolution and management service, then the insurance company deny the claim, because they will say this service is bundled with surgery. And the E&M service and the procedure service should be performed on the same day. If today a physician perform the E&M service and next day he perform the surgery, in that case there is no need to use 25 modifier with E&M service. And again, it should be with minor surgery only. So the global period of the particular surgery, 0 days or 10 days. And next thing, we need to check the diagnosis. So the diagnosis with E&M should be different and surgery should be different. So if we go through one example, that patient came for hypertension management and physician also perform abscess and drainage, incision and drainage. So for the hypertension management, if patient is established patient and came to the physician office, we will provide 99213. And for incision and drainage, the CPT code is 10060. And this incision and drainage CPT code global period is 10 days. So what we need to do? Because both the service perform on the same day, in that particular scenario, we need to provide modifier 25 with E&M service code 99213. But if the surgery performed next day to the E&M, okay, this is the same patient, and if he came for evolution and management service on 2nd of April and 3rd of April, the incision and drainage service performed, in that particular scenario, there is no need to provide modifier 25 with evolution and management service. Next modifier we have 57 modifier. So 57 modifier we need to use when physician perform evolution and management service and also perform major surgery. Major surgery can be performed on the same day of evolution and management or the next day of evolution and management. But if the surgery performed after 2 days of the evolution and management, there is no need to provide modifier with evolution and management CPT code. So 57 we can only use if surgery is major surgery, and it can be done on either on the same day or the next day. So if I take any example, one example, physician provide the evolution and management service and decided that patient need a bypass surgery. So bypass surgery code 33533 have a 90-day global period. In that particular scenario, we need to use 57 modifier with evolution and management service. If the surgery, bypass surgery performed next day, or the total knee replacement who has 90-day global period performed next day, in this particular scenario again we can use 57 modifier with evolution and management service. But if the surgery performed after 2 days, suppose if E&M performed 1st of April and surgery performed 3rd of April, in that case we cannot use modifier 57 as it's not required with evolution and management service. So for 25 modifier, the E&M and surgery should be performed on the same day. But in 57 modifier, surgery and E&M can be performed on different date. Global period of the surgery should be 90 days. And the reason for the surgery and E&M can be same. But in case of the 25 modifier, the reason for the surgery and the evolution and management should be different. Now the next modifier is 24 modifier. So when we can use 24 modifier? 24 modifier we can use if patient is in the global period and he came for evolution and management service. So evolution and management service, it can be related to previous surgery or it cannot be related to previous surgery. If evaluation and management related to previous surgery, rather than using 24 modifier with evaluation and management, we need to use 99024 CPT code and it's have $0 value. And if evaluation service is not related to the previous surgery, we need to use evaluation and management code and we need to provide 24 modifier. So the reason for evaluation and management during the global period is very important. If it's related to previous surgery, you cannot use E&M code with 24 modifier, you need to provide 99024 code. And if it's unrelated to previous surgery, then you can use E&M service code and you need to provide 24 modifier with evolution and management service code. Next modifier we have 26 modifier, TC modifier. So 26 modifier and TC modifier normally used with the radiology service. So 26 modifier is the professional component and TC modifier is the technical component. And if physician or we can say radiologist who own the hospital or clinic and also make the report, then the billing will be the global billing. So in case of the global billing, there is no need to use 26 or TC modifier. So we can understand this with a grid. So the first criteria, if radiologist on the office or clinic and make report of the patient. So whatever the instrument is there, whether it's ultrasound, CT or MRI, he perform the procedure and also make a report. So there is no need to use 26 or TC modifier. But if physician only make report, the procedure has been performed in the hospital or other imaging center and the radiologist only make the report of the patient, in that case we need to use 26 modifier with the procedure performed. But if hospital perform the radiology service but did not make the report, then hospital need to use TC modifier with the radiology service. But if you are giving the CPC certification exam, there is no need to take the option, if any option which contain the TC modifier, because CPC is only for the physician services. So TC modifier can be only used if hospital billing is there. Next modifier we have 58 modifier. So 58 modifier is a stage procedure. 58 modifier is a stage procedure. So if physician perform a part of surgery and then later decided that he will perform the other part of the surgery after maybe 2-3 days or after 1 week, in that case we need to use 58 modifier for the planned procedure. But again, it should be planned procedure, because once physician perform the surgery, there will be definitely some sort of global period is there. And if the procedure is planned, then it's the responsibility of the medical coder to provide the 58 modifier. Because if it is not related to the previous surgery, then we have other modifiers, which we will discuss later. So if I take the one example that physician perform mastectomy and plan the breast reconstruction for next week, in that case we need breast reconstruction code 19342 with 58 modifier, because it's a planned procedure. Then we have 78 and 79 modifier. So it's again related to the previous surgery. So if physician perform the surgery and due to some difficulty during the global period, patient came to the hospital. Now again a surgery performed on the patient. So there may be a two reason which we need to ask ourselves as a medical coder. Is the surgery which performed related to previous surgery and the procedure is unplanned? Is there any infection? If answer is yes, then we need to use 78 modifier. And if answer is that no, this surgery is not related to previous surgery, in that case we need to use 79 modifier. But 79 or 78 modifier we can only need to use if patient is in the global period. So I will give you some example. For example, patient underwent a pacemaker implantation. Now there is a infection in pacemaker. Physician remove the pacemaker and insert a new pacemaker. So what happened in this scenario? We need to use 78 modifier because it's related to the previous surgery. So we need to use 78 modifier with the removal of the pacemaker and insertion of the new pacemaker. Next example, if physician perform PTCA after pacemaker surgery. So pacemaker has been done in the past. Now patient came for the PTCA, percutaneous transluminal coronary angioplasty, and he is in the global period. So PTCA is not related to the pacemaker. So in this particular scenario, we need to use 79 modifier with PTCA. So 58 modifier is used for the stage procedure, but again it should be related to the previous surgery and it is a planned procedure. 78 modifier we need to use for unplanned procedure, but it should be related to the previous surgery. And 79 modifier we need to use for unrelated procedure and patient should be in a global period in all three scenarios. Next modifier we will going to discuss the 50 modifier. 50 modifier we use for bilateral procedure. If physician perform procedure on left as well as the right side, in that particular scenario we need to use 50 modifier. But always remember, if the procedure is already bilateral, okay, so there is a code available for bilateral procedure, then there is a no need to provide code for bilateral in that scenario, because CPT itself saying that this procedure is bilateral. So you cannot use additional 50 modifier with this particular CPT code. So normally extremities are, because we have two extremities, one left and one right. So physician perform any procedure on the extremities, then we need to use 50 modifier if there is no bilateral code available. I give you the example. If physician perform 3 view of both hand in the hospital setting, okay. So in that case, because the procedure has been performed in the hospital setting and report made by the radiologist, so first modifier you need to use 26 modifier. And then again it's a bilateral procedure and we do not have bilateral code for hand x-ray, then we need to use 50 modifier. So the correct coding will be 73130, which state that hand x-ray 3 views, and 26 modifier showing that the procedure has been performed in hospital, and 50 modifier is say that the procedure is bilateral itself. And if this same procedure is performed in the physician office, then there is no need to use 26 modifier. And we also have LT-RT modifier. So if physician perform procedure on the left or right, so rather than the 50 modifier, we can use either LT modifier or RT modifier. Then we have 51 modifier. 51 modifier we need to use if physician perform more than one surgery in separate operative session. This 51 modifier cannot be used with E&M service or the physical medicine, vaccination or add-on code, especially add-on code. You need to remember that add-on code we cannot use 51 modifier, and we cannot use 51 modifier with the higher CPT code. It can be used on the lower well. So if physician perform one procedure for $1,500 and another procedure for $500, so if we are supposed to use 51 modifier, then we need to use with $500 procedure value. Then we have 52 and 53 modifier. 52 modifier we need to use if physician start the procedure and achieve the target and stop it intentionally. Okay, in that case we need to use 52 modifier. 53 modifier we need to use if physician start the procedure, but due to some difficulty he is not able to complete the procedure, then we need to use 53 modifier. So most of the time physician complete the procedure, but still if you able to find any difficulty that physician did not complete the procedure, then you can use the 53 modifier, or a physician stop the procedure without completing it, then we can use 52 modifier. Colonoscopy is the good example. So in the diagnostic colonoscopy, you will put normally 53 modifier, and in the surgical colonoscopy, you need to put the 52 modifier. We will discuss more and more about this when we will do CPT coding. Next modifier we are going to discuss 59 modifier. So 59 modifier normally we use for distinct procedure, or we can say if there are services which are bundle but modifier is allowed, then we need to use 59 modifier. So 59 modifier we can only provide if we check the bundling issue in the CCI edit. So CCI edit normally either we will get into the Encoder Pro, Codify or 3M software. So if there is a bundling issue is there but modifier is allowed, then we can use 59 modifier. But for the last couple of years, we can say 8 to 10 years, Medicare is not allowing 59 modifier. So they have a separate set replacement of 59 modifier. So there are 4 modifier which Medicare accept instead of 59. So these modifier are XC for separate encounter, XX for separate structure, XP for separate practitioner, and XU for unusual non-overlapping site. So modifier 59 you can understand once you will be in the surgery coding scenarios, then you can only understand. Otherwise for the exam prospective view or for the interview prospect view, you should be know that modifier 59 used for distinct procedure, and it only used when there are bundling issue and modifier is allowed, then we can use modifier 59. Next we have 62 modifier. So 62 modifier we will use if the surgery has been performed by 2 physicians. Okay, so there are 2 surgeons and who perform the same surgery, but 62 modifier should be allowed with that surgery. So 62 modifier is the only modifier in which Medicare or any other insurance pay more than 100%, because if somebody put 62 modifier, then he will get 62.5% of the total billed amount. Next modifier is 63 modifier. 63 modifier need to be used if patient weight is less than 4 kg. So obviously patient weight will be the less than 4 kg in case of newborn or infant only. 66 modifier we use for surgical team. If like single surgery performed by multiple surgeons at the same time, then we can use 66 modifier for each surgeon. Then we have 76 modifier. 76 modifier we need to use for repeat procedure by same provider, same day. So suppose if in morning physician perform one view chest x-ray, and in the afternoon or in the evening the same provider perform another one view of chest x-ray, in that case the second time when he perform the chest x-ray, we need to append 76 modifier. So in this particular scenario, 76 can be used only if the service has been provided the same day, physician should be the same and procedure should be the same. So same day, same physician, same procedure, then only we can use 76 modifier. If procedure performed on the same day and same type, but provider is different, in that case we need to use 77 modifier. So suppose if in morning Dr. John perform procedure and in evening Dr. Michael perform procedure, in that case with Dr. Michael we need to append 77 modifier. Again, it should be same in the nature. If one view x-ray in the perform in the morning and one view x-ray in the afternoon or evening, then only we can use either 76 or 77 based on same provider or the different provider. Then we have assistant surgeon modifier, 80 modifier. So sometime some insurance company pay 80 modifier and some insurance company pay AS modifier. So 80 and AS modifier is for assistant surgeon. But again, we can only use assistant surgeon modifier if assistant surgeon allowed for that particular procedure, because what happens that maximum time you will not able to find that particular CPT can be built with 80 modifier. So if 80 modifier is allowed, then only you can build the CPT code with 80 modifier. Again, this information you can get from Encoder Pro, Codify or 3M software. Then we have 81 modifier for minimal assistant surgeon and 82 modifier for assistant surgeon when no residence available. But these are these are not used frequently, so you can just have this information only. Minimal assistant you can use 81 modifier, and if there is no residence available you can use 82 modifier with assistant surgeon. Then we have finger modifier. So finger modifier, we have 10 fingers, but it can be only 2-digit number. So that's why modifier always start with the left. So we have left hand. So left hand thumb, we have a FA. Then for the index finger, F1, F2 for the middle finger, F3 for the ring finger, F4 for little finger. Then we have right hand, F5 for right hand thumb, F6 for index finger, F7 for middle finger, F8 for index finger, and F9 for right hand little finger. So you can easily these modifier by counting on your finger. Similarly, we have a modifier for toes, and these start with the TA. TA for left great toe, T1 first toe, T2 second toe, T3 third toe. So we have different modifier. Then we have modifier for eyelid. So we have 4 eyelid, 2 upper eyelid and 2 lower eyelid. So left upper eyelid we have E1 modifier, left lower eyelid we have E2 modifier, right upper eyelid we have E3 modifier, and right lower eyelid we have E4 modifier. So if physician perform procedure unilaterally, we will use E1, E2, E3, E4 modifier. But if physician perform procedure bilaterally, we cannot use these E1, E2, E3, E4 modifier. In that particular scenario, we can use 50 modifier. So if the physician perform procedure on eyelid unilaterally, you need to use E1, E2, E3 or E4 modifier. But the procedure performed bilaterally, then you need to append 50 modifier with eyelid procedures. Then we have coronary artery modifier. So coronary artery modifiers are RC for right coronary artery, LC for left circumflex artery, LD for left anterior descending artery, RI for ramus intermedius, and LM for left main coronary artery. So whenever physician perform procedure on these artery, especially the angioplasty, you need to append these modifier. Then we have Q6 modifier. So Q6 modifier normally used for locum tenens. So what is locum tenens? If any physician who is a part of the hospital is on long leave and hospital arrange alternate for that particular physician from other than the hospital physician. So he called a physician who is working in different hospitals. Then if that particular physician see the patient, it will be considered locum tenens. And in case of locum tenens, we need to use Q6 modifier. Then we have clear wave. In case of clear wave, we need to provide QW modifier. So QW modifier you only use with the pathology test. Then we have 91 modifier. 91 modifier can be used for repeat lab for medical necessity. So it should be a medical necessity should be there. It cannot be like if the hospital or the physician miss the sample of the patient, then we can use 91 modifier. To use 91 modifier, there should be medical necessity. So these are the common modifier which we have discussed. So when you are in the surgery coding or evolution and management coding, surgery coding, the common modifiers are 51 modifier, 59 modifier, 52 modifier, 53, 58, 62, 78, 79. These are the modifier which normally we use with the surgery. And for the radiology service, I told you that 26 modifier is very common. TC modifier we normally use with the hospital billing. And for the evolution and management service, we have 3 modifier, which is 25 modifier, 57 modifier and 24 modifier. 25 modifier and 57 modifier perform if the ENM and surgery perform side by side. So in case of the 25 modifier, surgery and ENM should be performed on the same day. But in case of 57 modifier, surgery and ENM can be performed same day or surgery can be performed next day of the evolution and management service. And there is another difference. 25 modifier used when global period is either 0 days or 25 days, and 57 modifier will be used if the global period is 57. ICD code in case of the 25 modifier need to be different, but ICD code in case of the 57 modifier can be same. So these are some common modifier which we need to remember on our fingertips. Whenever you go for like coding, surgery coding or evolution and management coding, or you go for the examination or you go for interview, these modifier will very helpful for you. So if you need any other information or you need any specific video for any topic, you can drop WhatsApp message on 9911593677, or you can write email on us info@genushealthcaresolution.com. Our team will connect with you, and whatever query you have, we can resolve for you. We provide CPC and CCS certification training. We also provide surgery, ED, ENM, IPDRG, all sort of training which required to enhance your career in medical coding.